One, thanks for joining us for this session of the LPCA Compliance Institute. Today we once again have Bill Carberry back with us, and he is going to be talking about the human resource function as it applies to compliance guidance, and specifically relating to licensure and certifications, education, and exclusions. So Bill, I'm going to turn the presentation over to you at this point.
Oh, thank you all for coming back again. We, as we normally do, as we start with, we try to do the same kinds of things. You've probably seen this slide before, and I know it's hard to remember this, that compliance does not get you into trouble, it keeps you out of trouble. I know sometimes it's hard to remember that, but you are trying to get yourself and stay out of trouble. We're trying to just assist you all in how to set up your compliance plans. And again, one of the slides that we always use is that we're trying to say the compliance is just really doing what's right. Today we have a very interesting conversation, which is about the exclusions list, and I'm going to maybe be going out and pulling some other things in for you all to look at. I'll show you where to get them, but our first bit of housekeeping here is that, as you can see on this compliance syllabus, is you've got the financial relationships slated for August 31st, which obviously that is not going to happen. I believe that that is slated for October 26th, and it's going to be taught by an attorney who you all work with through the LPCA, because a lot of this stuff is legal stuff, and I'm not a lawyer, therefore we don't do legal stuff, but we'll be on the line monitoring. And then the last one, which is on the HIPAA and HIPAA compliance, is going to be slated to be November 30th. So if you just make those changes to whatever you're doing is October 26th and November 30th, and I'm sure that we'll be getting out invitations just shortly. We're going to be talking about licensure, certifications, education, and exclusions, because in the human resources function, you have a number of things that you have to do in terms of human resources, and one of which, and I'm skipping through these slides because we've had them on everything that we've had so far, and I'm just going to go right all the way down here to the key elements. And one of the things, the key elements of the compliance program, is conducting appropriate training and education. So that's where we're going to start. And in the human resources function, it's very, very complex, and I have put here on the next two slides, these are some, these are not all, these are some of the laws that are related to employment laws and resources. And so I put this on here. You should be able to just click on these, and it should go directly to a website. Now, your local laws are also in play and in effect, but this is the national ones. And then just to make it sure that you're really confused about it, it's a whole nother slide behind that that has all of those things. I personally cannot remember all of these things, is that, and because of that is that I generally make sure that what we have is we have a really, really strong personnel policy and strong policies and procedures on what we're doing, so that then, and we keep updating that to make sure that if there were any changes in the laws that we go forward. Recently in the news, we have seen a couple of things regarding military coming back from Iraq and Afghanistan, and people not holding their jobs for them, and that is you're supposed to have their jobs available for them when they come back. So, you know, then if you look up here, is drug testing, is what can you do, what can't you do, how you deal with veterans, and then back on this back page is comp time, fair wage, and I believe on October the 1st there's going to be a change in a change in who you have to pay overtime to if they are exempt employees, and I think that the limit was 27,000 and now it's 43,000, and I don't know how that may affect any of you all with respect to overtime. You're going to have to look at that. I can also tell you that there is a move afoot to cancel that to cancel that new regulation, but stay on top of that to make sure that you don't have employees now who are exempt who would qualify for overtime under these new regulations. And talking with your attorney and staying abreast of these labor laws will help you on that. But I know that that is a major change and a major shift that's coming. And what that law is related to is that it used to be as if you made $27,000 and above, no, they didn't have to pay you overtime for in a supervisory position if you were an exempt employee. Now I think that number is $43,000, and I don't know how many of your employees would be affected by that. So if you're making greater than, if you're making $43,000 or less, you would have to pay overtime for anyone who worked over 80 hours. So it's something you really need to look at. I'm looking at it here where I'm currently doing a long-term consulting arrangement with someone, and that's one of the things coming up. And I have 2 employees that this fits, and so now I got to figure out what we're going to do with them. But that is out there. You probably need to look at it and see if it does or how it does affect you. When we look at the policies and procedures, is under one of the elements. This is the written compliance policy and procedures provide a clear explanation of your compliance goals. Effective policies and procedures should be relevant to day-to-day responsibility, distributed to relevant personnel, and periodically reviewed to evaluate the effectiveness. So they're looking at the policies on how we do things. Things change. For example, what we were just talking about, that as to who qualifies for overtime, who does not qualify for overtime. I am out in Nevada right now. In Nevada, we probably all have something in our personnel policies that says you can't discuss wages amongst yourselves. Well, Nevada has said, no, you can. So those are some things that you have to look at in terms of policies and procedures, is whether or not you have things which you cannot do any longer. And those things need to be updated, and they need to be real sure that that you're compliant with those things. And also review your personnel job descriptions and your policies that you have to make sure that they're still relevant with what you are doing in today's world. I've seen some where we discuss all of the paper forms that we use, and we don't use those paper forms anymore. We use the electronic health record and so forth and so on. So there's some very interesting things that you need to make sure of in your human resources policies. The OIG compliance plan, it just simply says is that there's an implementation of written policies and procedures, and you have active and adaptive personnel training. Most of the time, and I'm sure that you all, most of the time people do what they think they're supposed to be doing, and they don't know that what they're not supposed to be doing. So we have to see what they're doing, and then we have to see whether or not there are changes in their job descriptions, or the way things are handled. And we're going to go through these 2 things, one more in depth than the other, and we're going to just go right into it. Personnel, on the personnel policies, it's the backbone of the compliance plan, which includes the code of conduct, which we have discussed before. It establishes the rules and regulations, and it standardizes the treatment of the staff with the hiring and how you discipline. We generally get into trouble when we don't do the same thing the same way every time. So that's why you need to have good, strong personnel policies. They should be reviewed at least annually, or if something comes up like this rule that has just changed. In the code of conduct that we have is that we've got is that it's, and I think we've been through it at length, is that it's the statement of your ethical and compliance principles, your ethical and legal standards, how you expect your people to act and work on a day-to-day basis, and it should be reviewed thoroughly with the employee upon hiring, followed up and reviewed by all personnel and updated periodically. And it's not bad for you to annually, when you're doing the annual reviews, just to make sure that you go through all of this with everyone all again, so that it just stays forefront in the mind. One of the places where I work, which I think I have told you all, is that they remind us on a daily basis of what their mission, vision, and values are. Is that they are very strict on how we're supposed to conduct ourselves. One of the elements is the education and training, and it just says an effective is rooted in active and adaptive education, and inadequate training significantly increases the risk of compliance issues. And let me just give you a couple of examples. Is that there is in the billing program, as I'm sure you all are aware, is that there is a place of service that you have to put. You have to put a location. And one of the more recent things that I ran into is that a physician was seeing his patients, and he was seeing patients that belonged to a nursing home. And so someone decided that he or she was going to put all of his place of services at the nursing home and not in his office. So everything that he did looked like it was done at a nursing home. Well, all of a sudden he gets a phone call because when they looked at his spike, is that he's seeing every patient 2 to 3 times more than what he's, and when we went back to the employee said, oh, well, I just thought that was what I was supposed to use. We had to do a whole bunch of work to get this back. It's to teach them how to carry out. The department managers and compliance department are responsible for evaluating the effective of existing education training methods. You generally do that through the audit and audit process, is that you audit bills to see what they're doing. You audit charts to see whether or not the documentation supports the billing. So it's generally done through some sort of audit program, and then what you do is that based on the audit, which is the adaptive education, is that you do the audits, you do internal, external audits. I don't like using the word audit because an audit is a very specific thing and there are specific auditors, but we generally try to use them as reviews. We normally do our reviews on a pre-bill basis, because if we can correct the errors before we go out, we know that it is not an error. So we do pre-bill audit reviews on documentation. We do pre-bill on the billing processes, that we look at bills that were ready to be shipped to the billing company, and we look at them to see whether or not they are. We pull maybe a day's worth, so we hold a day that we don't bill. But we then go through and we pull random and view those. And then the errors that you find, you go through a formal education process, document that you did it, who was there, and then that is a way to do your internal auditing and your internal monitoring. And you can do that in a number of different ways, in a number of different places. Is that we don't think about it, but actually having a third party coming in and auditing your bank reconciliation. So if you audit your bank reconciliation on a monthly basis, and it's an outside consultant, that is a compliance type activity, and you should be rewarded for that. And if you see something that doesn't appear to be right on that, is that then you correct it and you do it better the next way. So look at all of the things that you do and figure out the easiest ones you can do and get through, and then do the education. The two main ones that we always talk about is the documentation review of the medical record, and then the billing review of the billing of the actual bill versus what was actually put in the chart. So you say it's a 99213, and we look at the code, and I actually had a biller tell me that she just thinks the doctor, she said, I think the doctor is actually doing more work than this, so I put it up to a 99214. The physician had marked a 99213. She decided that it should be a 99214. I didn't know how to respond to that, except really you shouldn't. So we just go from there. Now, in the overview of the health center requirements, which is the conditions for what is it called? I want to say conditions for participation, but I know it's not. It's the conditions of conduct. There's 19 key elements, and one of them is services. And I'm going to go straight to that one because it is a requirement that you have. The staff must be appropriately licensed and credentialed and privileged. So you must make sure that folks have the appropriate licensure or credentials and are privileged to do what they're supposed to be doing. And in Louisiana, for the most part, is that you have nurse practitioners, and there are some particular, not peculiar, but some particular rules and regulations governing nurse practitioners and how they work and what they are allowed to do and what they're not allowed to do. They're not allowed to give pain medications, and there are just some things that they're not supposed to be doing. Pain medication, I'm talking about for opiates for pain management, is that they're not allowed to do those types of things. So look at what they're supposed to be doing, make sure you're not doing those, because those are your local laws, your local rules and regulations. So it's licensing, which says that they have a license to do what they're doing. Credentialed means is that you have agreed that they can do that, and if they have an offshoot of visiting a hospital or nursing homes and so forth, is that they are credentialed at that nursing home to be able to do work in that nursing home, and then that they have to be privileged is that the things that they are allowed to do where they're credentialed. So just make sure that those are all in effect. The staffing, it says that, again, that they will be credentialed, privileged to perform the activities in the health center, and then it gives you the credentialing. Staffing should be culturally and linguistically appropriate for the population being served as noted in the healthcare center's needs. So if you are in a place like I was at one point in South Texas where 80% of the population spoke Spanish, is you try to have either a Spanish-speaking practitioner or an interpreter there with them at all times. So that is your staffing requirements. You need to review those staffing requirements to see if you meet them. Now, when you come to checking someone's credentials, is that there is one of the goals or one of the areas that gives particular concern is it's a primary source verification. You're going to see that listed in just a minute on one of the slides that I have. And the primary source verification says you must go directly to the original primary source. So if somebody says they graduated from LSU Medical School, you have to go back to LSU Medical School and get the information that you need. If someone says they graduated from the St. Louis School of Nursing in St. Louis, Missouri, you have to go back and get the documentation from there. So just simply them providing you with copies is not good enough. You have to do the primary source verification. Now, there are companies that do primary source verification and so forth and so on, so it can be hired to be done, but you're supposed to do the primary source verification. Now, you only have to do the primary source verification once, and that's on hire. Then you just have to make sure that everything remains valid, and we're going to get to a little bit more about that in just a moment. Here is of how to do licensed independent practitioners, and then you can see, and this form, I think I have made this form has a link to it, which I think is right here. Just download this and look at it, because I'm going to show you portions of it here in a moment. I may also be able to find how to do that on my computer because I have it drawn up on another thing. But it tells you who and how, and so you can do it for an individual. Let me go to it here. I think this is my ending the show. And I believe that I have it right. Goodness gracious, I got too many things open. I believe I have it right here. There it is. Okay, here it is. Can you all see that it's just the rest of the form. When you hit that link that I showed you earlier, this is what you get. And then here is what it tells you. And it tells you what you need and where you need to go get it. For the licensure, for any of these folks, it says it's a primary type and the verification source is the state licensing board. CV, just need a copy of that. Education and training, it tells you where to get that, confirm the highest level 3, and it tells you all of the things that you need to do, and it also gives you a checklist of where to get it. And so, and then you can have that, and you would have that in your file at least one time. And so there you have it. Now this is for the licensing of independent practitioners. If you don't have one of those, but remember the primary is only done once, and then you re-credential, and it's required every 2 years. So when you're doing your re-credentialing, is that using a form like this will help you, because it'll give you dates that you've verified and initialed and expirations and so forth and so on. And it allows you to keep track of it. So then, page 2 of it has, immunization, PPD, life support training, hospital admitting privileges, on and on and on. So it gives you everything that you would need in order to do this, and then take it all the way to the governing body for credentialing and re-credentialing. And I'm sure that you all have a form like this or this form, but it is important for you to do that on everyone who requires some type of credential that you have, particularly your nurse practitioners and so forth. It wouldn't be bad to have this type of thing on any other licensed professional, whether it's a pharmacist or whether it's a nurse, an RN or an LPN or a physical therapist or so forth. It wouldn't be bad for you to have that same type of information. So let's go back to my slideshow. Go back to this one. And we'll go back to slideshow. From current slide, there we go. So that's what the rest of that form looks like. Okay. And any questions on that? I don't see.
Yes, we do have one question, Bill.
Sure.
With regards to credentialing, if we were to contract MD from Tulane or LSU, can we use those institutions as the primary verification source?
Generally speaking, yes, is because they're supposed to have all of that information on board, but in reality, you're supposed to at least verify that you're checking the checker. Is that you would like to trust the folks at Tulane, but you would also it would be best as if you went back, as if somebody said that they graduated from the University of Mississippi, is just write to the University of Mississippi and ask them if they did that. If any of you all are old enough to remember the movie Catch Me If You Can, is that the protagonist in that movie was an actually real life character, is that he was the director of pediatrics for 3 years at a medical school in South Georgia. They didn't do their primary care. They didn't do their primary verification. So yes, you can use that because you're just contracting with someone. Yes, you can. Should you go further? Yes, you should. If it's not too onerous, then yeah, go do the rest. Anything else? Okay.
That's it.
We're going to shift gears now, and we're going to go into the exclusion provisions. The exclusion provisions are the most onerous things that you can possibly have happen to us in the very recent past. And it is, we are not supposed to employ anybody in our company who has been excluded or debarred from the Medicare or Medicaid program anywhere in the United States. And I put this advisory bulletin up, which is this thing right here, and then this is the bulletin itself that it came out in 2013, where it established what they want. And if you click on that little thing right there when you're on the website, is that you're going to wind up with this this document. Now, here is the problem with the document. And the problem with the document is that agencies have the authority to pass interpretive rules. And interpretive rules are guidance documents. Interpretive rules describe how an agency interprets a broad statute. In this May 13 special bulletin court, and it is an interpretive rule. So Medicare says, or CMS says, we do not want anybody working who has been excluded from the program. The OIG came out and said, this is what we think they mean. Well, when they said that, is that it became an interpretive rule, and the courts always, most always, defer to the agency's interpretive rules. Rare instances, the court will not defer if the guidance is erroneous or inconsistent with the regulation. It is unlikely that the OIG's May 2013 guidance is plainly erroneous. Therefore, everything recommended in the OIG's May guidance, this little thing right here, everything in that thing has the full force and effect of law. So this piece of paper is really, really bad, because the OIG recommends that to determine the person's lived screen in the LEIE, the provider should review each job category and contractual relationship to determine whether the item of service is being provided directly or indirectly, in whole or in part, payable by a federal health care program. If the answer is yes, then the best mechanism for limiting CMP liability is to screen all persons that perform under that job category. Since you all do 90% of your business is paid for through the Medicare program or the Medicaid program, in fact, everybody in your organization who is employed by you should not be disbarred or excluded from the Medicaid program, Medicare-Medicaid program. So that means is that, in fact, you need to check everyone that you work with that is employed. Secondly, people who perform a function for you that is reimbursed part or in part by the federal government, an outside billing agency. The billing agencies, all of their employees cannot be. The pharmacies that you do business with, if you have a contractual relationship with them now, and I'm just talking about a contractual relationship with the pharmacy under the 340B program, I'm not talking about you hand somebody a script and they go. A pharmacy that you work with or contracted with, they're supposed to prove that all of the pharmacists are licensed and not debarred. So it is a very, very big program, and they are really starting to enforce this. I have just seen a recent thing where there were 14 pharmacists working for a pharmacy chain, and it cost the pharmacy chain somewhere around $12 to $13 million to pay the fines on this. So yes, you have to do it. No, I'm not sure that I like it. Two, I'm not even sure. I know how it can be done, but it is extremely onerous. We're going to go further. Providers should determine whether or not to screen the list and so forth and so on. We're going to that one. Example that you screen nurses provided by staffing agencies, physician groups that contract with hospitals to provide emergency coverage, and billing and coding contractors. Alternately, the provider could choose to rely on a screening conducted by the contractor. Now, and this would be a legal question to your attorney, is that somewhere in a contract that you have someone is that they say that they agree that they have not hired anybody who is excluded from the Medicare or Medicaid program. However, the OIG recommends that the provider validate the contractor is conducting such screening on behalf of the provider by requesting and maintaining a screening documentation. So something from them that says we screened our people and everybody that we have is good. So you, without saying anything more, you can see this is a big thing. I mean, it is huge. in terms of the time that it takes you to do it, in terms of screening everybody that you come into contact with, the whole group. I think that we have talked about it before, is that even with peak performance working with you all through the LPCA, is should the LPCA actually check to see if I have been excluded from the program? And the answer is, according to this, yes. So it is, should the LPCA be checking their own employees to see whether or not they have been? And the answer is yes. Now, if I remember correctly, they are doing it, so that's not a big problem. Just trying to this is just unbelievable. John, who is my partner in peak performance, and when we first talked about it, he just said, I don't know how people are going to be able to do it. And so we have to do it. So now, the frequency of the screening. The frequency screening, there's two things in this. The provider should check the LEIE, and there is a thing called LEIE and SAM to determine the exclusion status of a current employees and contractors. They're not required, providers not required by statute or regulation to check the LEIE, but it is a tool that's been made available. And because there's no statutory or regulatory requirement to check the LEIE, the providers may decide how frequently to check the LEIE. Okay, so we've said that. So you get to decide. So right now, you could do it on hire, which probably everybody does. You could do it on the annual evaluation and so forth and so on. However, the OIE updates LEIE monthly, so screening employees and contractors each month best minimizes potential overpayment. Additionally, in January 2009, CMS issued a state Medicaid director letter recommending that states require providers to screen all employees and contractors monthly. In 2011, CMS final regulations mandating states to screen all providers monthly. I'm waiting for a pause here. Unmute to see how many people are still alive, Christine.
We do have one other question, Bill, but it's going back to the primary source verification. Would you like me to ask it now?
Sure.
Where can I go to confirm if a company provides acceptable primary source verification, and how can I ensure that the company I'm using for primary source verification meets necessary criteria?
It would be in your contract, is that they should, and again, this is legal, not a lawyer. It should be in your contract with them, is that they should explain what they do and how they do it, and then they should indemnify you that they are doing it correctly. So that would be a lawyer question, but something from them either in their contract or when they send you a packet is that they're signing something, a legal document that says we have done this the right way. But I'd first look at my contract to see what it said, because your contract may, I'm looking at a contract here where I work, and in the contract itself, I'm going to cross over, is it says in there is that in the contract is that they are assuring and validating is that no one has been excluded. Well, you want to see the same thing in that file that says that they are doing primary source verification, and then with definition of what they mean by primary source verification somewhere in your contract. And I think that have your attorney look at that to see whether or not that's cool. Okay. Okay, everybody recovered from the monthly, taking every one of your employees and running them through the LEIE and the SAM and to see whether or not they've been excluded from the program. And you've recovered from the fact is that you're supposed to do this to all the Medicaid programs in the United States of America who have it, and to verify that. By the way, There are only 34 states, I think it is, that have the Medicaid exclusions, and the problem with these is that they are not always up to date. At one point, the state of Louisiana was 90 to 120 days of reporting people who have been excluded from the program on their website. So you could, in fact, check a website in January and hire me, and then February, March, and April is you'll find out that I was excluded as of January. So this is huge, huge, and we've not gotten any other regulations on anybody making it smaller. In some states, and I don't believe that that Louisiana is one of them, but in some states, particularly I know the state of Texas, is that when you sign your Medicaid, you re-sign your Medicaid affidavit saying that you're going to be a good person, and you sign that and the physician signed that, there is a statement in there that you have a compliance plan and that you are checking the exclusions list. So read some of those affidavits a little more carefully this coming year. But I already know what this means to an organization with 20 people. I know what it means to an organization that has 100 people. I have no idea what it means to someone who has 1,000. Now, there are firms out there, and I'm not going to give any names of anyone. I'm not endorsing anyone. I have looked, and there are 3 or 4 outside programs that will do all of this for you on a monthly basis. Some of them I like, some of them I dislike. Some of them are pennies per employee per month, and the only thing that you're required to do is monthly send them an updated Excel spreadsheet of your employees or the people that you want to be revised, to be reviewed. They will give you back a report. You can access it at any time to check if you're going to do a new hire. And there are 3 or 4 companies out there that do that. I think all you have to do is just type exclusion companies or Medicare exclusion companies, and you'll probably find 3 or 4 or 5. It is pennies, but in an organization such as you all or where I am, where every penny counts, is that, you know, 80 cents a month is still 80 cents a month if you've got 80 employees. It's still 100, you know, 100 pennies a month is still 100 pennies a month. So you all have to decide individually how you want to handle this, but that is a way. Okay? All right. Just to give you an illustration of how funky this is, story of Crystal B. In 1993, Iowa gave Crystal B a registered nurse license and multi-state privileges under the Nurse Licensure Compact. In 1994, California gave her one. In February 2005, Iowa placed Crystal on probation. In March of 2005, they indefinitely suspended due to substance abuse. In August of 2006, she became licensed in Wisconsin. In April of 2006, she completed her probationary period for the Iowa board. In December of 2007, she tested positive for morphine obtained by diverting the drug while on duty. In June and July, Wisconsin, North Carolina, and Arizona revoked her license. In November of 2008, Iowa revoked her license. In November of 2008, Iowa revoked her license. In 2010, she was placed on the SAM exclusion list. In 2010, she was placed on the suspended and ineligible list. And she is still not listed on the LEIE. So when you go to the OIG LEIE list, which is just on the OIG website, and if you go to the OIG website, which I think I had pulled up here, if you go on the OIG website, you'll be able to just simply see that. I have to find where I have it. Let's go to webinar, so that's all of you. I don't have it up, sorry. But if you just go to the OIG website, there is a thing called exclusions on it, and when you get to those exclusions, it just simply pulls up and shows you where you need to be.
Bill, I just sent the link to that to the entire audience.
Perfect, perfect. Thank you. It's just amazing. It really just is amazing that of how what this means. So now our next steps, we go back to what we did before. This is what we need to do. This is where we need to go. And basically that is absolutely the end of what I'm doing. I've taken 40 minutes of your time. I'm throwing it wide open to questions. You can unmute people and they can just free for all, and we can commiserate with one another as to how awkward this thing is.
We have a couple of other posted questions.
Okay.
Is there a way to provide a list of the companies that might be recommended for checking exclusions on behalf of a health center?
Well, again, if you just go on your website and you type Medicare exclusions, I know that one of them is called exclusions.com, and I can't remember some of them. I could put that list together, but it's not a recommendation. These are just companies that I know. I think if you just go into a search bar and you type Medicare exclusions, you'll probably get more companies than you would possibly want. Let's just go here and just see what we come up with. Let's see if we do come up with anything. Medicare exclusions. And let's just see what we get. Medicare exclusions list, and we'll just see. Medicare exclusions check, verify, comply is one. Medicare exclusions search now, which is Office of the Inspector General. So there's one company right there, which is verify, comply. There's streamline, verify right below it. There are just a number of companies, and I really don't have anyone that I would say is better or worse. Okay, so just do what I did, and you'll get who you want and see which ones you like. Okay.
And the next question is, are both the LEIE and state databases required to be reviewed?
Yes. Yes, based on this right here. This right here. It just says unequivocally yes. It says in CMS issued the final mandating states to screen all enrolled providers monthly. So is this a mandate? According to this, yes. So here we go. Here we go. Just read the footnote here. Is CMS clarified it does not mandate states to require their Medicaid providers to screen providers and employees each month. However, CMS recommends that state consider making this a requirement for all providers in contract, including managed care entities. So yes and no. As a minimum, as an absolute minimum, I would probably do all of my licensed personnel as frequently as I could, and then do all the other staff. But yeah, it's a tough law right now. It's a tough regulation. It is a tough interpretation. Yes. What else we got? What's the site for the LEIE? We just sent that out. That's on the OIG. And then there is another one called the SAM, which is also in the same place.
If anyone else would like to ask a question verbally, you can raise your hand and I will unmute your line, or you can type in your question in the questions box.
I think we're in shock.
Okay, well, it doesn't appear that there are any additional questions, Bill, so thank you very much for your time today and your presentation. And for everyone else, if you do have some follow-up questions you think of, you can forward them to me, Christine Forstner. That would be CFOERSTNER@lpca.net, and I'll get them to the appropriate person or to Bill, whichever the question requires. Thank you so much, and we look forward to your participation again next month at the end of October. We will be sending out an invitation to register for that event to all prior participants of any of our Compliance Institute series sessions, as well as the CEOs of all of the FQHC organizations that are members of LPCA. Thank you. Everyone have a good day.
Thank you, ma'am.